Welcome to the Health Trip Podcast. My name is Jill Foose. I'm a functional medicine and integrative nutrition health coach. I created this podcast to bring you along as we travel down intriguing, science-packed roads, debunking old medical paradigms and perusing new innovative therapies and modalities with the finest functional medicine doctors, practitioners, and like-minded biohackers while living our best life. Enjoy the show. Hi, everyone. Welcome back to another episode of the Health Trip Podcast. I talk an awful lot about women's health, especially as it relates to menopausal years. Today, I am focusing on men's health, specifically about testosterone. About 40 to 45% of men over the age of 45 have low testosterone or low T. Younger men can also experience low T even when in their 20s. Low T levels are correlated with poor nutrition, age, sedentary lifestyle, poor sleep, alcohol or drug use, prescription drug use, exposure to toxins, stress, and genetics. There are also serious health risks associated with low T, such as an increase in cardiovascular disease, osteopenia or osteoarthritis, a decrease in lean body mass, our longevity organ, chronic brain fog, and of course, sexual dysfunction. Low T leads to depression, more stress, and a feeling of hopelessness and low confidence. One of the first questions I ask my male clients is, how's your libido? Because it tells me a lot of information about his health and lifestyle. It's a fantastic marker to look at for overall health in men. The good news is that there are many options and lifestyle changes available to optimize testosterone levels. And that's what we're here to talk about today with my guest. My guest is Dr. Tracy Gapin. He is board certified by the American Board of Urology and is a fellow of the American College of Surgeons. He is a leading Gainswave provider and founded the Gapin Institute for High Performance Medicine in 2017, focused on helping men optimize their health so they can fulfill their highest potential. He offers a personalized path to helping men maximize their physical, cognitive, and sexual health. Dr. Gapin is also the author of the best-selling book, Male 2.0, Cracking the Code to Limitless Health and Vitality. A little medical disclaimer before we dive in. By listening to this podcast, you agree not to use this podcast as medical advice or for making any lifestyle changes to treat any medical condition in either yourself or others. Consult your own physician for any medical issues that you may be having. This entire disclaimer also applies to any of my guests on this podcast. So we've got a great conversation coming up with Dr. Gapin, and sit back, open your minds, and tune in. Hi, Dr. Gapin. Welcome to the Health Trip Podcast. So glad to have you here today.
Hey, Jill, how are you? Glad to be here.
So let's just dive in because there is a lot to cover in men's health.
Yes.
So you spent a lot of years in the conventional medical healthcare model, and then you moved over to a more functional medicine approach. Did something happen in your own personal life, or was it lack of results that you were seeing in your patients that led you down that path?
Yeah, great question. It was a combination of both of those. You know, I was a very busy urologist in a high volume practice for 20 plus years. And about halfway through my time there, I got to a point where I woke up one day and realized I was 30 pounds overweight, felt like shit and couldn't do it anymore. And didn't like who I'd become. I realized that I needed to make a change. And so I went to my concierge doctor friend for some help. And what I unfortunately learned is that we don't have health care. We have disease care, we have crisis care. And because I didn't have any actual, formal diagnosis, ICD-10 code, any disease to treat, he was somewhat lost in what to do with me other than simply eat more vegetables, exercise more, and lose weight. And that was really all he had for me. And I knew I needed a lot more than that. But at that time, I didn't know much more than him. I as a men's health expert that I was, I realized that I didn't have the answers either. And so I went on a journey, on a quest, if you will, of studying and researching anything I can get my hands on. And I learned about, first it was epigenetics, the science of how our lifestyle and environment affects our body's performance and function. I learned about precision medicine, how to use genetics to individualize healthcare. Learned about functional medicine, learned about hormone optimization. And I realized as I went through formal hormone optimization training that as a men's health expert that I was as a urologist, we got zero training in urology residency on how to actually optimize hormones. And I realized that we were doing it all wrong. We had no idea what we were doing. And so I learned how to implement that. And I learned about peptide therapy, which is an amazing tool we can talk about. Learned about a lot of anti-aging protocols, age management protocols, if you will, and how to use wearable technology and how to incorporate some of this biohacking stuff that's out there, as long as there's science to support it. And Jill, what I found, the secret was combining those disciplines together, and the sum is greater than the parts. Right. And so I integrate functional medicine as well as all these other disciplines, and I was able to transform my own health. And I realized that I was onto something here. And so I started introducing these concepts with my patients, and they had the same great results. And as that grew, and as I suddenly found my passion for medicine again, through all this, it got me down the path where I realized I could have a much bigger impact out of urology, out of traditional medicine. And so I'm now happy to call myself a recovering urologist. Now I've been out for a year. I launched the Gapin Institute for High Performance Medicine a little over a year ago, and haven't looked back.
So when you brought all this into your new practice, how were your patients who may have already been established in your other practice? How was their initial response to all of these new protocols?
Yeah, there was definitely a transition there. There were a lot of patients who I saw in my urology practice who no longer fit in the current model that I created, because so many people are still stuck in this disease model world. Use my copay to pay for a doctor visit, to get a prescription medication, to stamp out this symptom as a Band-Aid until the next time. And it's this ugly, vicious cycle that just doesn't work. And so what I do now is focus on, really, if I can put it down to one simple word, it's optimization. Yeah. And I'm not okay with treating your symptom or disease just to get you back to neutral baseline. That's all traditional medicine does. And so to answer your question, a lot of patients are no longer with me because they're still stuck in that disease model world and they can't see the bigger picture. And so it's really introducing a new concept. And I've created this concept of high performance health, which is a brand new concept to a lot of people. And it's really all about how can we optimize every aspect of our health, because I really believe that the success we achieve in life starts and ends with our health. And if you don't have that, you got nothing.
Absolutely. And there is no magic pill out there for any of this. It is all about stacked protocols and lifestyles.
That's right. That's right. And traditional medicine was really all about that magic pill. You know, I'm sure we'll talk about men's health as we move along here, but the big thing that I would hear every day was, hey, doc, I just want the blue pill. Yeah. And it completely ignoring the cause of the process that caused him to want that. And so it's diving deeper that I can have a much bigger impact.
Yeah. So speaking of the little blue pill, why should men be practically obsessed with their testosterone levels?
So great question. So when we talk about sexual function, you know, I think of it as four components that need to all come together. One is hormones. So testosterone is where you're going with this. So I definitely want to dive deep into testosterone. But testosterone is one part of the much bigger picture when we look at sexual function. You need good blood flow, so we can talk about the vascular system. You need good nerve function, and you need the psychology as well. You need intimacy, attraction. I see a lot of guys with porn addiction, dopamine issues that can affect it as well. But diving deep into testosterone, it is a vitally important hormone for men. And most men are fixed and obsessed with testosterone, so they know that. I like to point out that that's one piece of a much bigger picture, but it definitely starts with testosterone. I am seeing in my practice on a daily basis, almost every single man I see has low testosterone. And this is not just about sex. It's not just about libido, sex drive, performance in the bedroom. It's not about building muscle and being able to lift harder. This is about energy, about mental focus and concentration and cognitive function. It's about cardiovascular health. You know, we know that men with low testosterone have about a 30% increased risk of a major adverse cardiac event. So it's cardioprotective. We know that testosterone is important for bone health. We know that it's important for metabolic health in terms of glucose regulation. It actually lowers LDL triglycerides. We know that testosterone actually reduces risk of prostate cancer. Let me repeat that because that always makes people confused. Low testosterone is associated with an increased risk of prostate cancer, which is very counterintuitive to what we've always been taught. And so testosterone is really about a man's life, Jill. It's not just about sex.
Absolutely. I talk about this often in women's health and how important testosterone is. And as we go through menopause, how that drops and nothing's bringing it back. You've got to replace it. And you have to support it by a healthy lifestyle. And it's not just about our libido either. It's about all the things that you just mentioned. So such an important hormone. Where
Absolutely.
does it even come from? How is it made in our body?
So testosterone originally comes from cholesterol. You look at the steroid biosynthesis pathway, excuse me. Cholesterol gets converted into pregnenolone. Pregnenolone gets converted into DHEA, which is a very important hormone as well. That's often deficient in men. And then DHEA gets converted to testosterone. And then testosterone can get converted to DHT or dihydrotestosterone, which is a much more potent androgen. And it gets metabolized down into estrogen, estradiol. And so, estrogen is a very key, important hormone in men as well, just obviously as it is in women. But men tend to think that estrogen is evil and that we don't want testosterone ever get converted into estrogen. Well, that's how it's metabolized, number one. And number two, estrogen is actually cardioprotective. It actually has a protective effect on the cardiovascular system and reduces risk of major adverse events. And so, yes, it's all about the balance. Men come in and they're obese and they're insulin resistant and they're inflamed and they have estradiol levels up here and they have testosterone levels down here. So sure, that's a problem. But estrogen in and of itself is not the problem. It's the ratio of testosterone to estrogen that we care so much about. That's what's more important.
So when you're testing for testosterone levels, and we'll get into what those levels should be, are you looking at estradiol as well?
I do. Absolutely.
The
Yeah.
FSH, the
Critically important.
LH?
Yeah. Very important.
Because that's not standard on a lot of tests that I see come in. A lot of my clients share their blood work with me because we'll do further testing on genetics and micronutrient deficiencies. And I can tell you that none of those panels on the sex hormones show any of that information except total T and free T.
Yeah. Yeah. We want to look at all those, I call it a symphony where you have all of these hormones coming together to create the outcome. You look at systems biology, and like you said earlier, there's never one magic pill. There's never one single thing like testosterone alone is gonna give a man everything he needs. It's the symphony that looks like testosterone with estradiol, with DHEA, which counteracts and manages cortisol. It's regulating insulin. It's vitamin D, which is a hormone. It's growth hormone, of course. It's on and on and on and on, all these hormones that we need to be sure that we're looking at. And it's a common mistake to just think about only testosterone.
Very interesting.
Yeah.
So let's talk about optimal levels of testosterone in men. I want to start from men that are in their 20s on up, only because I'm a mom of 5 and four of them are boys, and they're all, out of the house and doing their thing and all athletes. And, there have been times where some of their T has been tested low and some has been, normal. So I want to start with the 20-year-old range and how the testosterone levels change as men get older.
Yeah. So great question. So, and this is really an important point here. So there are 3 published studies, massive longitudinal studies that look at testosterone levels in men. One was here in the US, the Male Massachusetts Aging Study, and then there was one in Sweden and one in Finland. 3 studies that looked over 20 plus years. What are we seeing in testosterone levels? And what we saw, which was really important, and this comes back to answering your question, I promise, it showed a 45% decrease in free testosterone over 20 years. 45% lower free T than what it was 20 years ago. So if you take a 40-year-old guy today, his free testosterone is literally almost half what it was 20 years ago. Wow. It's insane. So now with that preface, when you look at a lab slip now, this is really important. We use the phrase normal a lot. Doctors like to say, oh, your testosterone is, quote, normal. But this is really the critical point here. When you look at a lab slip, LabCorp, Quest, any other lab, it's not normal. That range is not the normal range. This is really important. It's the reference range. That range on the right, this ridiculous like 193 to 700 stupid range you see for testosterone, is the reference range. So what does the reference range actually mean? The reference range actually means the average of the population.
Right.
So what LabCorp does, and this is why each lab you get is a little different, that range. The reason they're different is LabCorp takes the average of all the millions of men's testosterone levels they've tested. What is the median? And then statistically 2 standard deviations on either side. And that gives you your bell curve range, if you can imagine, of your reference range. But that reference range is just the average of the population. Really, really important.
Yeah.
Go back to my preface. This is the reason why I started with that preface. Understanding that our free T is half what it was 20 years ago, you can now understand that that bell curve has shifted to the left over the last 20 years. That average has gotten lower and lower and lower every single year. So the reference range, what people call normal range, has gotten lower every year. That makes us make the mistake of thinking that a testosterone level of 200, well, that's in the range, so that means you're normal. Excuse my language, Jill, that's bullshit.
Absolutely.
It's not. So the key is what is ideal, what's optimal? And that's really the question you're asking. I just wanted for the listeners to make sure you understand that when you get a lab slip and it's in that range, you're not necessarily normal, ideal, optimal, healthy, where you need to be. You're just freaking average, which we don't want to be average, obviously. So to answer your question, we really, and the scales are different depending on the labs, and also whether the free testosterone, which is what we care about more than anything, whether it's calculated or measured. And so there's some slight variation in the scales. But we want a free testosterone of around 200 to 250, a free testosterone of 200 to 250. Now, depending on the scale, that may equate to 20 to 25. So you got to look at the scale you're using. Other labs where it's calculated, that number may be completely different than that scale. But we wanted a free testosterone of 200 to 250. Now, what total testosterone does it take to get there is a little different for every man, because proteins like sex hormone binding globulin, SHBG, which we can measure in that lab panel you talked about earlier, can bind to that testosterone and make some of it unavailable. And so when people ask me, well, what should my total testosterone level be? The answer is whatever it takes to get your free testosterone to about 200 or so.
Yeah. So I want you to just clarify the difference between total and free, because a lot of people don't really understand what that is.
Sure. Yeah. So think, and I normally draw this on a piece of paper. I can't for this podcast, but imagine you have free floating in your bloodstream a bunch of testosterone molecules. They're floating around, and that's your total testosterone. All the testosterone molecules are counted as the total testosterone. Now, for testosterone to work, to do its job, how does it work? Well, what it does is it goes into the cell, and then it goes into the nucleus, which is the headquarters of the cell, and it affects DNA transcription at the nuclear level of the cell. For testosterone to have any effect, it has to get into the nucleus of the cell. Well, if testosterone free floating in the bloodstream is bound to proteins like SHBG we talked about, or albumin to a lesser extent, or some of these other less common proteins, that's now a big fluffy molecule that can't get into the cell anymore. It's too big. And so that testosterone molecule is basically ineffective. Recent studies have shown that perhaps maybe it has some slight effect, but forget that for now and consider those molecules ineffective. So the free testosterone can be thought of as the soldiers in your army who actually have guns, who can actually do something. Whereas all the testosterone molecules connected to proteins are relatively ineffective. So that's why the free is so much more important than the total.
Right. Because it's the active form of testosterone. Is there something that's happening in certain people that's making it bind to proteins so it's unavailable to get into the cell?
Yeah, and this comes into genetics, where there are some men who have particularly high levels of sex hormone binding globulin. Things like obesity, insulin resistance, some other things can affect that to some extent as well. But a lot of it's genetic. And a lot of it, I can't tell you how many men I see every day who ask, well, how can I lower my SHBG to get higher free testosterone? And the answer is that there are some herbals like stinging nettle root has been one of the few that may have an effect. You can look at things like boron, maybe, although I don't know the science there is very strong. I think the real answer is that you just need higher testosterone levels to get to the free that you're needing.
Yeah.
Yeah.
So what are some common signs of a man that would have low T? And then I also want to, so wait, before we go on to that. So in terms of the levels of optimal levels of testosterone, like for men in their 20s, 30s, 40s and on up,
Yeah.
are you saying you always want that free to be around 200 to 250?
So great question. So as a man ages, we know that in general, once a man hits 50 and to some extent 40, but especially 50, a man's testosterone level will tend to drop by about 1% every year. That's just a natural part of aging, unfortunately. And we do everything we can to minimize that. And so we know that men in their 20s should have very high testosterone levels. We're talking total of maybe 1,500, 2,000, even with freeze of 250. And that's typically should not be a problem. What I'm seeing here today is probably half of the 20-year-olds I see have low testosterone as well. What we don't have is a scale that says a man who is 20 should have a T of 1,500, a man who's 30 should have a T of 1,400, and a man who's 40 should have a T of 13. We don't have a scaled metric like that, like I think is what you're asking.
Yeah.
What we know is that younger men definitely have much higher levels, which is ideal and optimal. How do you fix a man in his 20s that has low testosterone? That's a little more complicated than older men because we got to deal with the fertility issues and the long-term effects, et cetera. But suffice it to say, there's no absolute number for younger men versus older men.
Yeah. And when we get to some of the protocols that you have in place to help men increase their free testosterone, we're going to go back and talk about that 20-year-old who does have low T and how that looks for them.
Yeah.
But what are the common signs of a man with low T?
Yeah, great question. I would say there are three common complaints that I hear every day that would be most attributable to low testosterone. One is low energy fatigue, especially later in the day. The guy's at work and it's like 3 o'clock and he just wants to take a nap. Guys come in and tell me, yeah, take a nap every day around 3:30. Oh, that's a massive problem. Guys don't need naps. Men with low testosterone need naps. So one is low energy and fatigue. The other one is issues with weight, especially belly fat. You know, guys will have these extra 10 pounds around the belly, around the waist, and they can't burn it no matter what they do. This is where I like to say diet and exercise is not enough. You can do anything you can do dietary wise and exercise wise, but if your hormones are off, you're not going to burn that fat and lose that weight. So that's the other big one. And then the third one would be sex. You know, guys will, I'll very commonly see issues where they have low sex drive, low libido. They're just not interested. Their wife is suddenly chasing them when their entire relationship, they were chasing their wife. And I've actually had wives come in with them and they're actually concerned about infidelity because, hey, my guy not interested in me anymore. What's going on kind of thing. So it could be a real problem for relationships. And so that's why I like to point out that this is not just about men, it's about women as well, because it affects the relationship in many ways.
Yep. In my health coaching business, when I'm working with middle-aged men, more specifically, one of the first questions I ask them is, how is your libido? Because to me, it is such a great lens to look through in terms of what their lifestyle might look like, you know, in terms of nutrition, stress management, all of that.
Yeah, absolutely.
Yeah. So let's talk about some of those causes that affect a man's T dropping in terms of lifestyle, nutrition, environmental toxins, and so forth. I want to dive into these because, you know, we're going to talk about those really cool protocols to add into someone's routine. But before that, you got to get your lifestyle together.
Yeah, absolutely. So great question. When you look at those three longitudinal studies I mentioned, they corrected for diet and some other lifestyle factors as well. They corrected for obesity as well. And they still saw that dramatic decline in testosterone. And so I do believe there's a dietary component for sure. I do believe that there's clearly lifestyle factors that come into play as well. Stress, poor sleep, lack of activity. We can go into all that stuff. But the environmental toxins, the endocrine disruptors, to me, without question, is one of the biggest factors that is really not getting addressed like it needs. So there are studies that show that these chemicals in our environment are clearly associated with disruption of our endocrine system. That shows up as low testosterone, autoimmune disease, obesity, insulin resistance, even increased risk of cancers and depression, and even in kids, ADHD, et cetera. And we're talking about things like plastic water bottles.
Yep.
plastic K-cups, plastic food containers. We're talking about personal care products like deodorant, sunscreen, laundry detergent's a big one. The clothes you're wearing are laden with whatever chemicals they're washed in, and these chemicals are lipophilic, meaning they tend to get absorbed through the skin, through the fat layer of your skin. And so, personal care products, we can look at plastics all over. IV tubing. IV tubing in a hospital is made from chemicals that we know crush our health. Yeah. And so it's in the food that we eat. It's sprayed on our crops. It's the herbicides and pesticides that our crops are covered with. It is the lining of metal cans. There's actually a plastic lining of every metal can. Our animals are injected with synthetic hormones. Our water is laden with estradiol. Women birth control, estradiol has actually been measured in very high levels in our drinking water because our municipal treatment plants can't filter it out. Mm. And so, little things you could do every day by avoiding all these plastics. I always have a stainless water bottle with me anywhere I go. You'll never see me drink from a plastic bottle. I'm very careful about eating fresh organic fruits and vegetables, because if you're not, then your food was sprayed with potentially harmful chemicals. Organic grass-fed meats, wild caught salmon, for example, wild caught fish. These are little things, but they're big things. And
they add up.
They add up. Yeah, absolutely. And so when we look at the causes of low testosterone, one of the biggest ones is endocrine disruptors. And the way to address that is improve our detoxification systems, number one, but number two, really limit our exposures. And these are examples of ways you can do that.
So how hard was that for you personally when you went on this new, were opened up to a whole new lifestyle for yourself? How hard was that component? Because so many men, they don't think in terms of these little details of looking at ingredients on their deodorant, or mouthwash is a big one, right?
Yep. Yeah. The answer is it was not hard for a couple of reasons. Number one, I became obsessed with it because I saw the change it was making in my own health. I saw the change it was making other men's health in general. And it made me more and more passionate about pursuing this and learning more about it. Number one. Number two, I got my wife involved. Now that my wife understands this stuff as well, she has the apps on her phone. So whenever she's at the store, she's scanning barcodes. Yep. Environmental Working Group has an app called Healthy Living. You can use Yucca as another one, YUKA.
Think Dirty is one of my favorites. All my boys have Think Dirty on there.
Yeah, and Think Dirty is the third one. There you go. Yeah. And so getting my wife involved, now suddenly it's a family affair. It's not just me, and I'm passionate about it. And the third big reason is, when I work with men, one of the very first things we do is dive deep into what's your why. Yes. The guy's like, I want to lose weight. Well, no, BS. Why? Well, because I want to be thinner. No, why? Well, because my pants don't. No, why? And when you dive down deeper, there's always an emotional underlying major reason why you want to make the change you're looking to make. Right. And for me, it's my kid, it's my family, my kids, my beautiful wife, my two amazing little kids. They're 6 and 8, so they're still little right now. It's how can I be the best husband and father that I can be? And so once I recognize my why and put it out there in the universe, all I can do is live with intention and focus on that why. And so now, does that plastic water bottle align with my why? Clearly, no. And so that's how you make lifestyle shift, is by focusing on the bigger picture, what you're trying to accomplish, and does it align with your goals? Yes or no? Suddenly these micro decisions become incredibly easy.
Yeah, I love that. As a health coach, we work on the why, in the beginning of the journey. You got to know your why, right?
Yeah.
And your lifestyle that you create for yourself in your home has to be something that you can travel with, whether it's to your office, to a convention out of state, or on a vacation with your family. It has to be something that you're willing to commit to, that you can take along with you for the journey.
Absolutely. Yeah. One of my group coaching calls that we did was on travel hacks. And I went through that. It's probably one of the most popular one with the executives I work with, because they travel so much. And like you just said, you can't just stop all these things that we're doing while you travel, or else you're not going to be successful. So completely agree. Yeah.
Right. Because there's certain things you cannot control. Like when you're in a hotel room, you are exposed to whatever detergents and cleaners they're using in that room. But there's other things you can control.
That's right.
And so it's making it part of your routine, your everyday routine, and just practicing that every single day. It then becomes your new normal baseline. And you don't even have to think about it. But in the beginning, it can be very challenging for a lot of men. Let's talk about other lifestyle factors here, like nutrition. Let's start with nutrition. That's a big one. Well, we talked about eating clean, but in terms of focusing on certain macronutrients to help increase and support higher levels of testosterone, what are your thoughts on that?
Yeah. So, and I'm going to give you a little different spin than you probably normally hear, since I know you talk a lot about nutrition in your podcast. But to answer your question, testosterone, zinc, magnesium, B vitamins are definitely the key micronutrients that we want to focus on optimizing when it comes to healthy testosterone levels, especially if you're trying to do it naturally. So those are really the big ones. I like to look at nutrition in terms of not only what are you eating, but how you're eating and when you're eating. And so what you're eating, you talk about all the time. So I'm gonna skip over that just to focus on the different stuff. So you hear a slightly different spin on this stuff. Number one is, how are you eating? And what I mean by this is, with all of my clients, we use continuous glucose monitoring, CGM. CGM is a tool that has previously only been used for diabetics to understand how your blood sugar is responding to your activities. And so when I work with high performing individuals, I can now understand how your sleep impacts your blood sugar, how your stress impacts your blood sugar, which is really impactful, but also your meals. And so what I find with people when you track your blood sugars with CGM is how you eat is critically important. So what I mean by that is, let's say you're eating a meal with carbs, proteins, and fats. Let's say you have grilled chicken, quinoa, great healthy carb, and Brussels sprouts, let's just say. The order that you eat those in can dramatically affect your blood sugar. So what I mean by that is, if you eat the quinoa first, your blood sugar will spike. Massive spike, because it's pure carbs. Healthy complex carbs, but it's still a carb. Blood sugar spikes, and then it comes back down. If you were to eat the Brussels sprouts, high fiber, high good quality nutrients, low carb, and then the chicken, high protein, and then the complex carb, or this, if you're gonna have a baked potato, whatever carb you rice, whatever it may be, at the end of that meal, you'll see a dramatic difference in your blood sugar curve after that meal. And so how you eat is very, very important, in that you want to be eating the fiber, then the protein, and then the carbs with every meal. I would also emphasize that snacking is a big problem with guys. And so, yes, we want to follow our macronutrient ratios for the day. We want to make sure we're getting good micronutrients, but the timing also matters. So when is really important as well. We know that intermittent fasting has tremendous benefits for us, not just with weight loss. There was that shitty New England Journal study that came out like 6 months ago that tried to say that it's not helpful. Dramatic benefits for fasting, very clearly demonstrating. My battery's about to die and plug in. So we know that fasting has a tremendous benefit. You look at animal studies, and one of the single things that has been shown to very clearly extend lifespan, unequivocally, is fasting. In animal studies, fasting has been one of the few things that unequivocally show extends lifespan. And so in humans, there's still studies ongoing in humans, obviously, but we know that it has tremendous benefits in all the physiologic processes that we know cause aging as well. And so intermittent fasting is something that I recommend for most guys. That means eating within a 16-hour window, eating within a certain period of time during the day. You're fasting the rest of the time. Another spin on that you may not have discussed previously is, it's better for that window to be earlier in the day rather than later in the day. Yeah. So let's say you're eating and I think I said eating in a 16-hour window. I meant fasting in a 16-hour window, eating in a 6 to 8 hour window. Excuse me. Yeah. So preferably down to 6-hour window of eating, preferably fasting for 18 hours. The smaller you can get that window, the better. And it's better if you were to eat, let's say you ate from 8 a.m. until 2 p.m., 6 hours. Much better then fasting, then eating, from 2 p.m. to 8 p.m., and then going to bed a couple hours later. The longer the time interval between when your last meal was and when you go to bed has been shown that to be beneficial. And so that's why I like to not talk about just what you eat, but how you eat and when you eat.
Absolutely. Meal timing is huge. And when I think of like people snacking, to me, that's a red flag that maybe they're not hitting their macros in those 2 or 3 meals a day.
Yeah.
Making sure you get enough protein and fat to reach
Right.
satiety so that you
Right.
don't snack, because we don't want to be snacking all day because that keeps our insulin levels pretty high.
Exactly. Yeah. And a couple more thoughts on that is that when people snack, they tend to make bad decisions. They tend to eat foods that are typically not healthy for you. So if you're going to snack, if you have to snack, focus on something healthy like almonds, for example. Almonds are a great source of good, healthy fats, some protein in there, and at least that's not going to spike your blood sugar. Be careful. When we look at foods, what to eat again. 2 things to avoid for anyone, regardless of your genetics: the sugar and seed oils.
Absolutely.
I have pictures of a bag of almonds. My wife and I were at Target a year ago, and one bag has almonds, and you look at the ingredients on the back, and ingredients almonds, perfect. The next bag, dry roasted almonds, you look at the ingredients, almonds, corn oils, cottonseed oil, sunflower oil, safflower oil. And these toxic omega-6 pro-inflammatory seed oils are killing us. And so be careful with those snacks. If you're going to have something like almonds or whatever, look at the ingredients in those products.
Right. Those rancid seed oils and that sugar is what causes obesity. And how does obesity affect testosterone levels?
Oh my gosh. So fat has an enzyme called aromatase. Aromatase will take all your testosterone and switch it into estrogen. Dunzo. Fat will also increase cortisol. It increases stress. It promotes insulin resistance, which also crushes testosterone as well. And so really, really important that one of the biggest things that men can do to help naturally improve testosterone is to lose weight, burn that visceral fat specifically.
Right. Because isn't there a relationship between cortisol and testosterone, like the whole HPA axis? Can you just run us through that? Because people will come to me and say, oh, I was diagnosed with the HPA Axis Syndrome, but they don't even know what it is. Right. So I would like you to break that down for us.
Absolutely. Yeah. So we have the pituitary, the gland in our brain that ultimately is responsible for testosterone and estrogen and our hormone production. The pituitary specifically will send out a signal called luteinizing hormone, or LH, which tells the testicles to make testosterone. Now, the adrenal glands make 1% of our testosterone, but forget the adrenals for now and consider the testicles making the testosterone. Now, that testosterone will then feed back on the brain and tell the brain, hey, we got enough testosterone, we're fine, and luteinizing hormone will decrease. And that happens ultimately from the hypothalamus above. But to keep it simple, the brain sending a signal to turn on testosterone, testosterone feeds back and says, hey, we're fine, turn it off. Okay. So that's how your hypothalamic pituitary gonadal axis works.
Mm-hmm.
For cortisol comes from the adrenal glands, and you have corticotropin releasing hormone, which also comes from the brain, from the pituitary, and it will go to the adrenal and say, hey, we need cortisol. Why? Well, you're stressed psychologically. There's a traumatic event. You've been in a car accident. You're scared. You're running for your life from a tiger back in the caveman era. You got crummy sleep. You've overtrained. You are stressed out at work, pushing yourself too hard without rest. You are eating bad foods. The toxins we talked about earlier, any of these are stressors in our environment that are causing the pituitary to send out corticotropin releasing hormone, which stimulates ACTH to stimulate the adrenal gland to make cortisol. Okay, comes from the adrenal cortex. Cortisol then comes back to the brain, just like testosterone does. Cortisol comes back to the brain and says, hey, we're good, we got everything we need, but it's shutting off the testosterone pathway. And so now this cortisol, which in short term may be good for you. It may be good to help with a stressful situation. You know,
Right.
in a way, in the short term, it's anabolic. So cortisol is not all bad for you. It's when it's long term, when it's chronically elevated, that chronic overstimulation is what shuts off testosterone production. And so short answer is cortisol crushes testosterone.
And so, what are some things that you tell your patients to implement in terms of managing that chronic stress that everybody's experiencing?
Yeah, so it's looking at every one of those stressors. So number one is psychological stress, and it's funny. Most of the high performing executives and entrepreneurs I work with, or I have a race car driver and baseball players, and they're all like, "No, I'm not stressed, doc. I'm fine." And I say, "Nonsense. Come on, like I know you're stressed. You think you're not, but you are. Most people just
Right.
don't realize it." So, controlling the psychological stress, we look at things like mindfulness practices. Meditation is so incredibly important.
Yeah.
Breathing exercises, and everyone will immediately say, "Now I know how to breathe." You actually don't, because what you want to do is always breathe through your nose. Always breathe through your nose, never breathe through your mouth, and it dramatically affects tissue oxygenation.
Hmm.
And so I'll keep that story short to say always breathe through your nose. So that's going to help reduce the stress response. And then it's going to be things like making sure you're getting enough good quality sleep. So
Yeah.
what's your sleep hygiene like? What are you doing at night? Nothing raises cortisol more than crummy sleep. And so focusing on good quality sleep, focusing on the foods that you're eating, focusing on clearing toxins on your gut. You know, we haven't talked yet about the microbiome, but the bacteria in our gut controls our body. It controls our health. It controls our
Yes.
metabolism, our energy, our brain. Almost anything is affected by the bacteria in our gut. And so looking at ways of improving our microbiome and making sure that our gut is intact, you know, secretory IgA and inflammation and that sort of thing. And that again goes back to, you know, eating the right foods as well. So look at psychological stress, we look at food, we look at sleep, we look at making sure, you know, lifestyle wise, you're not overtraining,
Yeah.
making sure you have the right micronutrients, all those things together, again, from a systems biology approach, that's what it takes.
Yeah. And speaking of the gut microbiome, I want to talk about how certain pharmaceuticals, certain medications that people are taking affect not only their gut microbiome, but their testosterone levels.
Yeah, great question. So, you know, things like statins are the biggest culprit. We could look at things like PPIs, proton pump inhibitors, can definitely affect the microbiome as well. Super common problem. Um, I see so many men that come in uh, on so many prescription medications. It's almost like a trail mix of medications that they're taking, to have to go through one by one, whether the drugs are affecting sexual function or testosterone, the microbiome, or potentially even all of those. Very, very common.
Yeah. And then what about drugs and alcohol use?
So alcohol use is definitely going to raise cortisol. It's a stressor, again,
Yeah.
the ones that we mentioned. And so what alcohol will do is really disrupt sleep. So a lot of guys will say, well, I drink alcohol to fall asleep at night. Well, what it's doing is sedating you so that you can fall asleep, but you're getting really crummy quality sleep. And we could talk about stages of sleep, but specifically, we just want to focus on getting good quality deep sleep. And when you drink alcohol, when you take Ambien, Xanax, Lunesta, any of those drugs, prescription medications, it's sedating you, but it's not helping you get good quality sleep.
Right. And so wearing some type of measuring device on your sleep to be held accountable, right? You got to, some people, I am a results person. I have to see what's happening. So I wear a Whoop app. All my kids wear this. And I think my daughter wears the Aura Ring, but
Yeah.
whatever it is, looking at that data and thinking about what did you do the day before? Did you overtrain? Did you drink alcohol? Did you smoke a lot
Yeah,
of weed? I mean,
that's right.
now that weed is easily accessible, so many people are doing it more and more, right? It's easy. And that is having an effect on people's overall health, especially testosterone.
Yeah, absolutely. So when we talk about wearable tech, all my clients have to wear something, and I don't care
Yeah.
I wear a watch. I love the ring as well. There are straps, there are bands. I try to be relatively agnostic and not push any particular brand. There are pros and cons to each of them, so I can share those details. But as long as you're using something to track, again, the quality of your sleep, not just how long you slept, but how long was your REM sleep, how long was your deep sleep, and sleep latency, how long it take you to fall asleep. Stuff like that is really important. The other piece of wearable tech device or other tool that I use all the time is a heart rate variability tracker. Now, heart rate variability or HRV is a marker of physiologic stress. We talked earlier how important stress is and how much stress is crushing our health, especially testosterone. So we want to look at how our bodies are stressed on a day-to-day basis. Now, the Garmin and the Aura and the Whoop, they have HRV track, even the Apple one, which I actually, I love Apple, but I would never recommend the Apple Watch if we're looking at health. But they don't track HRV well at all. No wearable device will track heart rate variability as well as a chest strap. And so what I do every morning and what I recommend for my clients is when you wake up first thing in the morning, and I do this very first thing I'm doing while my coffee is brewing, I'll sit on the couch and I'll put my strap on, and it should be sitting down the same time every day, preferably in the morning when you first wake up. And what you can do with that, and I use the Elite HRV strap myself, is the one that I use, and that hooks to an app on your phone. And you can look at your HRV from one day to the next, and it'll give you a comparison so you can understand, just like you talked about your sleep, what did I do from one day to the next that affected it? What's causing that HRV change? It may be an indicator that you're overstressed. It may be that you're about to be sick. It may be that you need to take it easy. So that's a great tool to really get a window into your physiology.
Yeah, I agree. I have all of my clients, if they don't already own one, they need to go buy something so that they can start tracking this information. Right. All right, let's move on to some really cool stuff out there in terms of raising your free testosterone, starting with pellets. That seems to be one of the most common and accessible to people out there. And I also want to go back to talking about those guys in their 20s who have low T and why that wouldn't be a good solution for them.
Yeah. So let me organize it into natural things that we can do and not so natural things that we can do to raise testosterone. I think to kind of categorize it a little bit might be helpful for the listener. Natural things that we can do to improve testosterone, free testosterone specifically, would be number one, sleep. If there's one single thing you could do is just freaking go to sleep, create a healthy sleep hygiene habit at night, go to bed the exact same time every night and get at least 7.5, 8 hours of sleep, which will equal good quality sleep when you look at REM and deep sleep, hopefully.
Right.
Sleep, stress, obviously we talked about already. Strength training. So we're talking heavy strength training, especially the big muscles like the quad, the hamstring, the back, the core. Heavy strength training, not to the point that you're overtraining, that you're going too far, but definitely, 2-3 days a week, really working on aggressive strength training. Healthy micronutrients, macronutrients is really key as well. So those are and by the way, aerobic exercise, consistent, heavy aerobic exercise can actually be harmful for testosterone. So you want to be careful you're not doing too much of that.
All right.
So those are the natural ways. What I find is a guy comes in and his free testosterone is 45, let's just say. Again, it should be 200, 250, it's 45. And he says, well, can I do the natural stuff so that I don't have to get on testosterone pellets, et cetera? Yeah, sure. And so, I give him some good supplementation, zinc, magnesium, B vitamins, and other micronutrients, and make sure lifestyle wise he's intact. That 45 will get up to 70, 75, 80. Yes. It very rarely will get up to the 200, like the range where we really need it to be. So yes, for the listener, I want to clarify, yes, natural approaches do work, but typically not enough to get to that level where you're not going to need something unnatural. Okay. So that's the natural stuff. Now the not natural. There are really three ways in general of giving testosterone. One is a topical, one is an injection, and the third one are pellets, like you mentioned. The topical, we found that the absorption from the scrotum, application of a cream, testosterone cream on the scrotum, has massively improved absorption versus other parts of the body. So if a guy wants to do topical, we will often do topical testosterone on the scrotum. You got to do that every single day, though, because the half-life is so short. It burns up so quickly. Right. You got to do it every single morning. You wake up, you shower, you put it on. You can't touch your kids or anyone else with that testosterone in your hands because it can spread.
Yeah.
unfortunately, 10% or so of men will not absorb that testosterone enough so that the topical may not be an option for every man. Okay, so that's one option to look at. The second would be injections, and the injections can be either intramuscular, which is how they've always been given until recently we realized that you can give sub-Q and get the same levels. And so now most of, if you looked at my my patient list of the men who are on testosterone therapy, I'd probably say 90% of them are on testosterone injections sub-Q. Okay. And you can do that in the belly. So what I like about that is that you can use a sub-Q needle, and it's relatively painless. And you can do it when you do injections. You could do twice a week is ideal. 3 times a week would be optimal, would be great. Once a week would be less ideal, but preferably twice a week tends to be around the sweet spot that I can get guys to commit to being compliant and doing it regularly. And that's the best way, especially if a guy's just starting, to be able to instantly get levels up to where they need to be. So I can get a guy that has a free T of 45 and I can get him up to a free T of 200 within 2 weeks. So it's that easy to with injections.
Yeah.
And that's where most men tend to start. The third option, as you brought up, are pellets. And pellets are little tiny, they look like rabbit food, little tiny little tubular shaped pellets that get implanted into the butt or into the back using a little trocar device. We numb up the skin, clean the air, anesthetize the area with lidocaine, and make a small little puncture and introduce these pellets. What's attractive about the pellets is that they'll last for about 4 months at a time.
Right.
Yeah, so guys can get testosterone level boosted for 4 months. So guys in the military who are going to be going overseas, guys who travel a lot, can't come in often, or don't want to do injections, those will be guys who are potential candidates for pellets. The problem with pellets to be aware of is that it is often very variable what the absorption of the pellets is going to be.
Yeah.
And so I'll find that guys will get, let's say 15 pellets on one setting. We'll check a level a month later and the free T is 220. Great. We'll do the same 15 pellets 4 months later. We check a free T and it's 110. I'm like, what the hell happened here? And so there's a lot of variability in absorption of those pellets. Perhaps it's production of the pellets. I don't know. I'll always use high quality compounding pharmacies, but you never know.
Right.
But in reality, you're then stuck in that situation where now I can't really do much else with you until those pellets wear out. And so that's the challenge with pellets. The dosing is often difficult where you have to keep tweaking it each time. It's just not as easy as what I would prefer to do as injections.
Yeah. So these applications are basically the same as for women. I started on testosterone pellets many years ago.
Yeah.
And one of the injections, I mean, one of the pellet applications shot my testosterone up to over 900.
Whoa.
It was awful.
Yeah.
Awful.
Crazy.
So I had to wait almost 18 months for that to come down before I could switch over to topical cream, which is what I do now. But
oh my God.
yeah, I agree. Pellets are harder to manage. I like the idea of the shots and the topical cream.
Yeah.
But what about going back to those 20-year-olds?
Yes. So
Why can't they have that?
Yeah, sure. So, and by the way, real quick, Gapin Institute here, we do a lot of women's work as well. So my passion and focus is men's health.
Great.
I have a nurse practitioner who does a ton of pellets and she loves them for women. So I'm on base with you that that yes, for women, pellets are a great option, but there's some variability still. In men, I find a lot more issues with dosing, to be honest with you. But to answer your question, what was your question again? I'm sorry.
The 20-year-olds, why they can't
20-year-olds, sorry.
testosterone.
So focus on the women. So yeah, so the key thing with 20-year-olds is the fact that these men are still in their childbearing years. And when we look at fertility, we have to understand that that pituitary, again, I mentioned that LH was going to the testicles to tell it to make testosterone. Well, the brain also makes another hormone called FSH, follicular stimulating hormone, and it affects women as well. But FSH is what goes to the testicle and tells it to make sperm, specifically sperm. And so when we give testosterone, I mentioned earlier, it goes to the brain and tells the brain, the pituitary, hey, we're fine. We don't need any more. You can turn it off. We got enough. We're good here. Well, what that does is it also shuts off FSH. And so if you give a young man, especially a 20-year-old guy, testosterone, you're going to shut off sperm production by that negative feedback. And that's the real problem with it. And so for a young man, especially one who has any consideration for fertility, which includes most 20-year-olds. I mean, I can tell you when I was 20, I'd be like, yeah, I don't want kids. But then 10 years later, hey, I want kids. And so you can't do that to that guy. You can't potentially affect his long-term fertility. And so there are other ways, assuming the natural approaches haven't done the job, which is very, unfortunately, very common. We could look at things like HCG. HCG is an injectable that is homologous or very similar to LH, luteinizing hormone. It will mimic luteinizing hormone. And so we can give HCG and it will stimulate the testicles to produce more testosterone, but that's not going to have the effect of shutting off FSH like it would if you're giving testosterone directly. And so HCG is one option that you can do. The other option is Clomid.
Yeah.
So yeah, so Clomid is, you probably talked about this before. It's also used for women for infertility, and it's an estrogen receptor blocker at the brain level where it's going to block that negative feedback that I was mentioning earlier. It's going to block the inhibition of FSH production by testosterone, or specifically estrogen is what really doing that. So what I'll often do in young men, and I've had this a number of times, where HCG combined with Clomid, combined with the micronutrient support that guys need, will often be very effective at getting testosterone levels where they need to be, as well as preserving and supporting fertility. I've had a couple men, got maybe at least 10 men now, who have come to me for infertility specifically. And I find that they have low sperm production and they also have low testosterone production. And a lot of it's the pituitary is just not putting out enough LH and FSH. I've had a lot of those guys respond to HCG with Clomid, and many of them actually got pregnant from just that alone.
Wow. Yeah. And so what about Gainswave? I know you're a Gainswave provider. Tell us, so that's the brand name, the company, but tell us about acoustic wave therapy and how that works.
Sure. Yeah. So it's specifically shockwave therapy. So we've used that technology when I was back in my prior life as a urologist. We used that technology for 20, 30 years for treating kidney stones. So we know it's safe, it's effective at delivering sound wave energy into the body to create a cavitary effect to do whatever you're trying to accomplish. So for our case, we're using it for kidney stone treatment. It's also used for musculoskeletal injury repair and stuff like that. But what they found at the research level was that low intensity shockwave therapy promotes a process called angiogenesis, which is, for the listeners, that's just basically creating new blood vessels, creating new highways for blood to flow. And so they found that by introducing shockwave therapy to a vascular system, it will create it will stimulate angiogenesis and create new blood flow. And it's believed to be by the activation of stem cells. Stem cells are the progenitor cells that secrete growth factors, vascular-derived growth factor, other growth factors that will stimulate that construction of the new highways, the new blood vessels. And so they found that low-intensity shockwave therapy was actually effective at improving erectile function and treating erectile dysfunction and improving sexual performance. And so Gainswave is the brand that took low-intensity shockwave therapy and really brought it to the masses. Introduce it to clinicians. Here's how you can use this technology to treat ED to improve sexual performance. And so that's how Gainswave comes into play. The technology is low intensity shockwave therapy. Gainswave is the brand that introduces that and works with clinicians to help us improve patient education and support on proper technique for the therapy as well.
So it sounds really painful. And I know there's men listening to this right now, and they're going to think, oh my gosh, what does that even entail? So just don't get too graphic, but take us down that path a little bit.
It is not painful. Yeah, it's not painful. Guys do feel it a little bit. We actually give them numbing cream to put on the penis about 15, 20 minutes before the treatment, so they really don't feel it at all. But it is done in the procedure room. Guy lays on a table. My technician will take the ultrasound probe. Looks like an ultrasound probe. It's the therapy probe, and it's attached to the machine, and you'll hear a loud tick 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 as it's delivering the shock waves. And again, the guy can feel it, but it's really not painful. And it's done to the penis directly, and it will stimulate increased vascular blood flow, vascular formation. And it's typically done twice a week. Like we'll do it here in the office Tuesdays and Thursdays, and a guy will do it for 3 weeks. So 6 treatments, and then take a break for a month or so, and then do another 6 treatments. And throughout, he is continuing to stimulate sexual function by using a vacuum device, a penis pump, a way of promoting, I call it physical therapy for the penis, basically. It's penile rehabilitation, where you're stimulating it. And I say use it or lose it. I say that, you don't want to atrophy. It's smooth muscle that you want to continually activate. Right. And so I encourage regular sexual activity. I encourage regular stimulation if you're not going to have sex with your partner. And that continual stimulation is what's going to ultimately give the best outcomes.
So you mentioned stem cells, and I know stem cells, exosomes, ozone therapy injections, all of this stuff. Do you use all of this in your practice as well?
We do. We do exosome therapy. I want to be really clear for the listener that it's off label. So exosome therapy is used for regenerative purposes, is used for ED, it's used for anti-aging protocols, which some people scoff at, but there's some real science there.
Yeah.
So it is used, but again, it's definitely off label.
Yep. And what about ozone therapy?
We have not done any ozone therapy here. I do find it very interesting, and I have a couple colleagues who are into it, but we just haven't done any here yet. Yeah.
Yeah, it is really neat.
Yeah.
And then what about, there's a peptide that I actually tried once called PT141. And so peptides are really, really interesting to me. They are the wave of the future, if you ask me, in terms of regenerative medicine. But tell us about PT141 and why that is important in terms of sexual function.
Yeah. So first of all, peptides are a really hot topic right now. Peptide therapy is really an amazing precision-based strategy to achieve really specific outcomes. So first of all, what is a peptide? It's simply a short protein. It's simply a chain of amino acids. For the listeners, it's not a drug. It's not a pharmaceutical. It is a specific sequence of amino acids. It's not like collagen, which is just a bunch of amino acids. It is a specific sequence that has a very specific purpose. So for example, BPC 157 is a 15 amino acid sequence that comes from the stomach. Insulin is a peptide. Growth hormone is a peptide. Apidolon is one that extends lifespan in animal studies. It's just 2 amino acids in length. Thymosin alpha is a great peptide that comes from the thymus gland, which is where our immune system kind of originates from as a child, as a baby, and it shrinks and involutes and goes away as we get older. And so introducing those peptides can help rejuvenate your immune function and stimulate T cell activity. And then we can look at fun ones like PT141 you mentioned, which is a great peptide. It comes from the melanocortin stimulating hormone, or MSH family. The reason I bring that up is when you use PT141, it will cause tanning. It can cause incredible tanning in some cases if you're not careful. The PT141 is great for improving arousal, libido, works for both men and women, as you've experienced. And it's really, it's a fun peptide. It is, to be really clear, it's not going to treat ED. If a guy can't get an erection, it's not going to fix that. It's going to just enhance sexual arousal and performance.
Exactly. Yeah. But I think it's a fun one to add on to the protocol.
Absolutely.
Yeah.
It's the icing on the cake.
Yeah. So you wrote a book titled Male 2.0. Why does every man need to have this book in their arsenal?
Yeah. So this goes back to my years in urology, that I recognized that men were stuck in what I call male 1.0. And that is, and I was the same way. I was guilty of that as a physician, as a men's health expert that I was in urology. I was guilty of the same thing. And that is, we're reactive, we're passive, we're waiting for, if it ain't broke, don't fix it. If there's no disease, if there's no problems, then I'm fine. I'm good for now. Leave me alone. And it focused on waiting for a problem and then treating it with a simple Band-Aid solution, which is the typical way we think about healthcare. And so Male 2.0 was my introduction to this concept of precision medicine, of using genetics to individualize care, to being proactive instead of reactive, to not waiting for disease to set in, to individualize your care, to go deeper than just testosterone. Quit thinking testosterone shots are the answer to your problems, and understand why do you need testosterone? What's the underlying issue? And
Right.
addressing the physiologic processes like inflammation and oxidative stress and insulin resistance, and these other processes that guys tend to ignore. It's focusing on a deeper level of how we can optimize our health, and taking a very different approach for men's health.
Yeah, it sounds like a great book. It's definitely going to
Thank
be
you.
on the Hanukkah list this year for all 4 of my boys.
Perfect. I love it.
So tell listeners where they can find you, and if you have any free resources on your website that they can download to start integrating some of these practices today without even having to go see a doctor right now. Tell
Absolutely.
us all about that.
Yeah, sure. So my center is called the Gapin Institute for High Performance Medicine. The website, gapininstitute.com. I do have an offer for your listeners. I have a free copy of my Secrets to High Performance Health, which is a quick cheat sheet, a checklist that you can use to start implementing some of the stuff we've talked about today. The listeners can simply text the word health to 26786. Again, that's health to 26786. And they'll get a copy of my Secrets to High Performance Health. They'll also get a complimentary copy of a digital copy of my book, Mel 2.0, that you brought up as well. And they'll get a link if they want to jump on a call with my team to see how we can help you. You'll get that as well.
Oh, well, that's wonderful. Thank you so much. I will put all of this information into the show notes.
Perfect.
It was such a pleasure to have an hour with you and talk about all of this amazing stuff about men's health, because men don't want to hear it so much from their wives or their moms. They want to, discover on their own and be held accountable on their own. So I think this is all really valid, important information. So thank you once again.
Absolutely. You bet. Thanks so much.
I'll have to have you come back again and really deep dive on some of these protocols that we couldn't really get to. Yeah, that would be great. Sure. Thank you. Yeah. All right, everyone. Thanks for listening. Take care. Thank you for joining me. I hope you enjoyed the podcast. Lifestyle changes can be hard and overwhelming to make. By building your support team of functional medicine doctors, therapists, and health coaches, you can reach your optimal health goals. Be sure to check out my other podcasts. Until we meet again, stay healthy.